A 70 years old lady, critically ill with altered mental state, came to A&E with left iliac fossa tenderness. On examination, our BP is low. She is tachycardic, temperature is high, respiratory rate is 27 breaths per minute, pH is 7.32, partial pressure of oxygen is 9 kilopascal, partial pressure of carbon dioxide is 3.5 kilopascal, and bicarbonate is 16. Base excess is -6, and WBC count is 17,000.
Now, can you interpret the ABG?
Okay, so the patient is having and partially compensated metabolic acidosis. Uh,
All right, very
yes, sir.
good. Tell me the differential diagnosis of this patient.
Okay, the patient might be having constipation and perforated, or not perforated, diverticulitis and sigmoid volvulus,
What else?
and ureteric colic in left side.
Okay, and pelvic tumor, correct?
Pelvic tumor. Yes,
Because
sir.
he's 70-year-old. So now tell me about the. You mentioned about the arterial blood gases level. What about the WBC count?
Yes, sir. It is increased. It is 17,000, and there is leukocytosis, which tells there is infection ongoing.
Infection ongoing. Can you define the shock and what type of shock is present in this case?
Okay, so shock is circulatory failure in which there is decreased tissue perfusion leading to organ dysfunction, and in this type of in this there is distributive septic type of shock.
Can you define septic shock?
Okay, septic shock is circulatory failure where there is infection present, and it is characterized by persistent hypotension even after the fluid resuscitation, persistent lactate even after the fluid resuscitation, and persistent need of vasopressor to maintain the mean arterial pressure more than 65, and all this in absence of hypovolemia. So there is not hypovolemia.
Okay, very good, very, very good. Okay. Now, can you define sepsis?
Yes, sir. It is the life-threatening condition which is due to the inappropriate host response to any infection, inadequate host response to any infection.
All right. Now, how are you going to assess this patient? Or what are the signs of organ dysfunction? They can ask this question indirectly. How are you going to assess this patient? Or what are the signs of organ dysfunction?
Okay, so should I tell SOFA score? Or?
Yeah, yeah, go ahead. Tell me the SOFA score. I'm indirectly asking you, okay?
Okay, Q so far. Okay, so a blood pressure of less than 100, and altered sensorium, and decreased saturation,
You
and
mentioned about the
heart rate
blood.
of more than.
Go ahead, go ahead.
I will come back to it later. I
Okay,
forgot.
we will come back to this, all right. Now, tell me about the components of septic shock.
Okay, so as I already mentioned, there is a persistent components, a persistent hypotension,
Okay,
and persistent lactic, and requirement of vasopressor to maintain the mean arterial pressure of 65 millimeter of mercury,
okay.
and there is infection and sepsis ongoing.
All right, okay, very good. Tell me about the basic principle of the management of septic shock.
Okay, so I will manage the patient according to the care of critical ill surgical patient protocol following ABCDE, and after stabilizing the patient uh, uh, for the airway, I will like to give a high flow oxygen by a non-rebuser mask, and I will resuscitate the patient with IV fluids, 1 liter per over the 1 hour, and also for from one cannula, I will take the blood for investigation and send blood hemoglobin, send for hemoglobin, urea and electrolyte, CRP, and blood culture and sensitivity. And also, if the patient is not improving, then I would like to give vasopressor, continued vasopressor to maintain the mean arterial pressure. And
Okay.
in the meantime, I will monitor cardiac monitoring, I will monitor cardiac index and also look for hemoglobin and lactate level.
Okay, very good. Okay, we'll come back to this as well. A little bit, few modification. What antibiotic you will
Okay.
use for this patient?
Um,
Okay, we will come back to
so,
this. Okay, this is
since
a new question.
anaerobic,
All right, we will come
anaerobic,
back to this. Okay, they are asking specific
okay.
antibiotic here. Now tell me, CT confirmed the presence of diverticular abscess. So what are the management options?
So there is open drainage of the abscess or image guided drainage of the abscess, and yes.
So tell me the advantages and disadvantages of the open drainage versus the image guided aspiration.
Okay, so the advantages of open drainage would be uh, it the peritoneal toileting would be more easy, and we can do the peritoneal toileting along with the stoma preparation. We can prepare the stoma uh, if required, and whereas there is chances of infection and patient morbidity might increase if we do openly. And versus the image guiding, then in image guiding it is easy, and there is no chances of there is less chance of wound infection, and patient can ambulate early and mobilize early, so there is less chances of any DVT. And repeated it can drain continuously through the pigtail. And
Okay.
disadvantages are it won't be able to drain all the abscess clear fully. And um, stoma, we can't make the stoma with
Very
image
good,
guided.
very good. Dr. Prabhat, you are doing superb. Okay. Now, that things that I would like to mention, if they ask you what is the management of septic shock, just remember we will give three things to the patient and we will take three things from the patient. So the things that we will give it to the patient, you will answer
Yeah,
like this, okay? We will give the patient like
yeah,
high flow oxygen, IV fluids, okay, and antibiotic, IV antibiotic. The things that we will be taking from the patient is the blood culture, okay, hemoglobin level, lactate level, and also we'll be checking the urine output of the patient. So how will you answer this answer? Like what is the management of septic shock? I'll manage this patient according to the care of critically ill surgical patient protocol. Within 1 hour, I will give high flow oxygen to the patient. Okay, I will give fluid, which is 30 ml per kg, and I will I will check the urine output of the patient. Okay, and also I'll be giving antibiotic according to the local trust policy and TPN, total parenteral nutrition, and you will take a blood for culture, hemoglobin level, lactate level. Also, you'll be checking the urine output of the patient. This must be done within 6 hours. Okay. After 6 hours, if the patient is hypotensive, we will go for the vasopressors to keep the mean arterial pressure more than 65 mmHg. This is the specific answer for the management of septic shock. Okay, remember as it is. Now, what are the antibiotics? This is a new question for this patient. Simple, gentamicin IV plus clindamycin or metronidazole IV, okay, or amoxicillin. So just mention these things: gentamicin plus clindamycin or metronidazole plus amoxicillin. So these are the antibiotic you will be using for this patient. Now, when they ask you what is the like the CT confirm the presence of diverticular abscess, so what are the management options? Again, you will start from the CRISP protocol: airway, breathing, circulation, disability, antibiotic according to local trust policy, and we can go for the open drainage versus image guided drainage. Then you will mention the
image guided.
they'll ask you advantages and disadvantages. So this was about this diverticular abscess. Simple, remember the advantages for the image guided aspiration is that it decreases the length of hospital stay, and also the decrease the risk of wound infection and other things what Dr. Prabhat mentioned. Okay, Remember as it is. Okay, this was the whole station that we discussed. Now let's go for the next station. Who is ready for the next one?
I can go, sir.
Okay, brother Muhammad. Can you read the stem loudly?